YouTubers! Good to be here again. I'm super excited to be here one more time. To my returning subscriber, we wouldn't have gone far without this. Thanks for always being there. To you that is just bumping into this video for the first time, please click on the like button, click on the subscribe button, and also on the bell icon to get notified each time we come live. Thank you. You know that collecting blood using vacutainer system is a common procedure in recent clinical settings. Vacutainer system is now gradually replacing the traditional syringe method that we know. So today we are going to be talking about the step-by-step guide to perform this procedure. Now, before we enter into the step-by-step, we are going to be measuring the equipment needed for this procedure. The equipment include number one, your vacutainer needle. The vacutainer needle comes in different sizes, like your normal syringe comes in different sizes. The vacutainer needle comes in 24G, 23G, and so on. So you choose the one that is convenient for your patients. Now, secondly, we have the vacutainer holder. Without the vacutainer holder, collecting a sample with vacutainer tubes and vacutainer needle will be very difficult. So there must be a holder for this procedure to be a successful one. Vacutainer blood collection tubes with their varying anticoagulants with their diverse functions. There are so many of them. We have the blue coated ones, we have the yellow coated ones, we have the red coated ones, we have the gray coated ones, and the purple coated ones, depending on the type of investigation the patient wants to carry out. The next thing you'll be needing is your tourniquet, your alcohol swab, your adhesive steps, and your gloves. Now, the procedure will be going to be involving number one thing, preparation. You have to make sure that your hands are sterile. Wash your hands before you wear your gloves. Get everything that you need for this procedure ready. Not like when your patient is ready, you will not be walking to and fro, going to get tourniquet, going to get alcohol swab, or getting to get your tools. Make sure that everything you need are ready for this procedure. Then identify the patient. Once you identify the patient, you explain to the patient the procedure. It's a non-invasive one. It's not painful. It's actually comfortable. So explain to your patient to make them comfortable. The next thing you're going to be doing is verify the necessary information, such as your patient's identity, which is very crucial. Once you verify this, make sure you label. For some facilities, they have a barcode which the patient's name, the patient age, the patient sex, the date of sample collection, the type of test the patient is going to be doing comes out. So the only thing you need to do is print out the barcode and stick on your sample bottle. But if you don't have that, you are going to identify your patient. Identify the type of procedure that the patient is going to do. Then write out the names, the dates, the sex, the age, and make sure you stick it on the bottles. The next thing to do is to select a vein. You apply a tourniquet around the area you want to puncture. The essence of applying the tourniquet is to restrict blood flow and make the vein more prominent. For some patients, if their veins are more prominent or prominent enough, you don't need to apply a tourniquet. But for those of them that their veins are a kind of hidden, you apply your tourniquet to make it prominent. Then ask the patient to make a fist. The essence of making a fist is to engorge the vein. It will make the vein to 1 pound small. Then prepare the area to select a suitable vein. For me, I always prefer using the medial pivotal vein because they are always more prominent. The next thing for you to do is to clean the puncture sites with alcohol swab in a circular motion from inside out. Allow the area to dry. You have to allow it to dry so that you won't cause lysis. When this one mixes up with the blood that is entering, this can affect the results. Then assemble the vacutainer needle and the holder. You need the needle cap. Anchor the vein by placing your thumb below the puncture site and generally pulling the skin tongues. Insert the needle into the vein at an angle of 15 to 30 degrees. Not like you now push the whole needle inside your patient's leg. That will be more painful. Make sure that the bevel is facing them. Before you insert the before you start the needle, make sure that the needle is facing up, because if it's facing down, it might be difficult for the blood to enter the tubes. Then collecting the blood. Once the needle is in the vein, attach the vacutainer tube to the holder by pushing the tube into the needle within the holder. Blood will begin to flow into the tube due to the vacuum. Fill the required number of tubes. Invert each tube gently after filling it to mix the blood with any anticoagulant present. You don't need to shake. Once you shake, our blood will get light. We don't want to have a light sample in the lab. Once you get a light sample, your result is going to be affected. We don't need that lysis. So we do a simple immersion so that you'll be able to mix the blood together with the anticoagulants. Now, release the tourniquets once blood begins to flow into the first tube to minimize hemoglobin concentration and discomfort for the patient. Remove the needle once all required tubes are filled. Place a gas pad over the puncture site without pressing down. You don't have to press it down once the needle is still there. Quickly but gently remove the needle and immediately apply pressure to the puncture site. Once the needle is out of the vein, you can now apply pressure with the cotton. Because if you apply pressure when the needle is still there, it's going to be very painful for the patient. So you now apply pressure to the puncture site with cotton wool or swab to stop bleeding. Dispose of the needle and the holder in designated sharp containers. After ensuring that the bleeding has stopped, apply an adhesive bandage to the puncture site. This is to, assuming your patient is going to go out, this is to avoid contamination, because you've opened there, it's going to be open. So you have to cover with an adhesive plaster. So after ensuring that the bleeding has stopped, apply. Okay, we've talked about that. Now, the vacutainer system is important because it is designed to minimize the risk of needle stick injuries to healthcare professionals. You know that when we're using a traditional needle, a traditional syringe procedure, there is always a likelihood that you can puncture your patient and mistakenly that needle gets to puncture you too. But once you're using the vacutainer, it has minimized that. And this all usually occur. So that's the sense of using, one of the reasons of using a vacutainer. Another thing is a closed system. Because it's a closed system, the blood collection process is closed, thereby reducing the risk of exposure to blood-borne pathogen and contaminants. So you're not going to get infected with blood-borne pathogens and contaminants. Now, the gentle vacuum pressure minimize the risk of hemolysis, which compromises the results. Once there is hemolysis in your sample collection, it compromises your results. So the gentle vacuum, which the vacutainer is making use of, does this. It minimizes hemolysis, it minimizes the risk of hemolysis, thereby giving us a very good sample to process. Now, for patients who have more than one or two procedures to do, multiple samples from a single puncture site. So once you puncture that one site, you can use the one puncture site to collect your various samples for your various investigation. So it reduces the need for multiple needle insertion and making the process quicker and more comfortable for the patients. So if you watched to this end, it means you enjoyed that video. Please, if you've not subscribed, please subscribe, please like, please also share our videos.